Welcome everyone to the Sex Intelligence series. I am Dr. Mike from Sydney, Australia, and today we are diving into one of my favorite topics, the love muscles. These are the muscles that support our body and very importantly play a huge role in sexual pleasure and function. Joining me today, Heather Ford, founder of CORE, a clinic dedicated to pelvic floor health, sexual function treatment and education. Heather, welcome.
Thank you. I'm so excited to be here today, and I'm so excited about this topic because honestly, the love muscles, aka the pelvic floor, is my favorite muscle in the whole body and what I refer to as the most important muscle when it comes to female pleasure.
Well, Heather, you're absolutely right. And today we will explore why these muscles matter, how to connect with them, and how my book, Unleash the Mysteries of Female Orgasms, helps you apply this knowledge in real life. Heather, from your clinical experience, why do you really think understanding the pelvic floor muscle is crucial for a good core stability, a good function, and a good sexual pleasure?
Yeah, absolutely. Let's start with the sexual pleasure side because I feel like this is probably one of the most misunderstood roles of the pelvic floor, and that is that the pelvic floor is absolutely jam-packed with beautiful nerve endings that can make pleasure even more pleasurable, particularly for a female. The other really important thing to note is that the pelvic floor forms a framework around your urethra, around your vaginal canal, and around your anus. So it's very important when it comes to sensitivity during sex. And the other important thing to note is that, like any muscle in your body, your pelvic floor needs to be able to contract and release to be able to make sure that your orgasms are as orgasmic as you want them to be.
Well, exactly. And I will add to this from the medical aspect is how contraction of these muscles engorge the blood vessels that allows this clitoral erection and vascularity. Well, the clitoris gets erected as much as the penis, and it needs all this blood supply, all this sensitivity, where the crury of the clitoris emerge and surround the vaginal wall. So that's a function of the pelvic floor muscle in men and in women. So in men, it's erection, it's delayed ejaculation. Controlling the pelvic floor muscle is essential. And you have the specialty for us all to understand what's going on.
Absolutely, and this is another misunderstood aspect of the clitoris in particular, and that is that it is a homologue to the male penis, right? So they're both made from erectile tissue. And the pelvic floor's very important role in the arousal stage of sexual pleasure, which is the initial stages, is to do a contraction to make sure that you keep all of that blood flow that your brain is sending down there in the vulval region. So that helps keep it juicy and plump, and as you mentioned, it helps the clitoris keep engorged.
Look, this is exactly, and I think people underestimate that the awareness alone and the improvement of the sexual function is essential. That's why it's called the love muscle. So yes, we call the pelvic floor and the Kegel, but we'll take it another function is love making. And so let's start with the basics. Heather, how would you explain it? How would you explain this love muscle to someone who's never heard about it before?
Great question. Okay, I like to explain the pelvic floor as a hammock or a basin shape. Now, it's got a couple of key functions. The first function is it forms the foundation or the floor to three very important organs that you have down there: your bladder, your uterus, and your bowel. Now, beyond that, it also has three holes in it. So those three holes support the sphincters you have down there: your urethra, where you wee from, your vaginal canal, where you do lots of fun things from, and your anus. We all know what that's for. So the pelvic floor is key not only when it comes to the engorgement, like we talked about, but also to help contract around those holes when you need to contract around them. For example, when you're about to jump on a trampoline and you don't want to leak, you got to contract that pelvic floor. Or during sexy time, you need to be able to contract around the vaginal canal to help keep things really pleasurable and grippy for you. And from your anus, of course, we want to contract when you don't want to pass a bowel movement unnecessarily.
So in our next session, we're going to talk about the pompoir. And the pompoir is the rhythmic contraction of the pelvic floor muscles. And I'll leave it now as a bit of a mysterious. And the pompoir is something that you control the rhythmic contraction of your pelvic floor muscle. That is a very deep sensation of pleasurable reaching orgasms. We'll
Yeah.
talk about next time. So, but I often describe these muscles as a hidden superpower. When these muscles are balanced, strong, flexible, and responsive, and they can completely transform how someone experiences intimacy. So, what are your thoughts on that?
Yeah, I think the first thing is the education gap when it comes to the pelvic floor, and also the stigma attached to it. So we're never, I don't know about you at home or you, Dr. Mike, but we were never taught anything about the pelvic floor in high school biology. And then for a lot of women, we leave high school, we go and study, we have babies, and all of a sudden we experience symptoms of pelvic floor dysfunction. And then there's a lot of shame attached to it, because obviously we know that 2 in 3 women are going to experience incontinence or leakage at some point in their life. And there's shame that comes with that. So the first thing is education, which is why it's so important that we're having these conversations and sharing this, to first of all explain that, yeah, it's really common, but it's absolutely not normal to have these dysfunctional issues when it comes to pelvic floor, and it is absolutely treatable. So first thing is to ensure that people have this like very open conversation and remove the stigma attached, but then also understand the vast benefits of having a functional pelvic floor. So we're talking from bladder control, from female pleasure, because the pelvic floor, as we mentioned before, is the most important muscle when it comes to orgasm, but also things like your strength and stability, particularly as we head into the perimenopausal stage. Because during peri, we know that we lose between 10 and 30% of our muscle tone, and the pelvic floor is not immune from that. So really important that we set ourselves up with the knowledge and also the strength in the lead up to the perimenopausal and postmenopausal stage.
And the relaxation. So it's very important as well, as much as we strengthen it, is to know how to relax the pelvic floor muscles. And I like that because that's what keep the balance, and we cannot separate pelvic health from sexual health. So as for the postpartum, and there are many real life stories. So Heather, you have worked with many patients or many clients and many postpartum women. What are your thoughts of how we can empower them to discover the knowledge, and what's the biggest gap you see in the recovery in postpartum and the pelvic floor muscle strength and relaxation?
Absolutely. Okay, there's 2 things I want to cover in this. The first is, and I'm going to blame Hollywood for this one, it's this culture of bounce back where it's all about diet and pushing women into extreme forms of exercise to try and fit into some mold that we're told is ideal. The first thing I want women to understand is in the postpartum period, it should not be about depriving your body or dieting. It should be about nourishing and looking after your body and loving your body, because it's been through probably one of the most the biggest changes that you could possibly ever go through. And so respecting that and respecting the recovery time is essential. The next thing I want to explain is that it's not about extreme forms of exercise either. It's all about listening to your body and respecting it and giving it movement that feels really good to you. One thing that we talk about when we're talking about ways to motivate women to have long-term changes is that in order to have a long-term change and something that you can maintain consistently, it's got to be something that you love. Because if you do exercise or you deprive your body out of a hate for your body or out of a dislike, it's only going to give you short-term changes. And we want to completely turn that around and give you a long-term, lifelong, a lifestyle change as opposed to a short-term change. Now, the other thing I want to cover in this is this kind of mindset that once you become a mother or once you're in the postpartum stage, sex should be deprioritized, or it should only be something that is seen as a chore, or something that you give your husband because it's what he needs. And again, I think Hollywood and movies have a lot to answer for when it comes to that. Because female pleasure should never be deprioritized, and women in the postpartum stage and well beyond should be having really fulfilling, beautiful sex lives, not only for their relationships, but also for their own physical and mental health.
Well, I really see that too. And the problem is sometimes shame and embarrassment is what stops women from talking loud about it. It's still a taboo, it's still a shame. And this exactly what we need to transform, unbreak it, open it, and be having the pleasure of discussing it and getting better at it.
Absolutely. So the shame is there, and I think the education, as we've already talked about, is so lacking. And another really crazy and scary statistic is that even in medicine, we're not keeping up, because we know that even to this date, only 6% of research is done on female-only participants, yet we make up 51% of the population. So there is still yards and miles to go when it comes to understanding the female body. But again, this is why these conversations are so important.
Look, it's really incredible how understanding anatomy, developing trust in your body first, and how this can reshape your pleasure, reshape your confidence, and overall your well-being, your creativity, your release of all your happiness hormones to the brain. So the anatomy of orgasm system, that is the configuration onto your brain centers is real, and people feel this creativity and empowerment. So where are a few simple steps that anyone can take, for example, to improve the function, strengthening and relaxation of these muscles?
Yeah, okay. So the most simple place to start is with your breath, which a lot of people are shocked by. But in fact, your diaphragm, which is your breathing muscle, is what I term your pelvic floor's bestie, and they do everything together. So if we start with diaphragmatic breathing, it is the best place to start when doing a pelvic floor contraction and release. So let's do one together. I always say, let's start by putting one hand on our chest and one hand on our lower abdomen or deep belly. And I want everyone at home to do this as well. So take a deep breath in through the nose and exhale through the mouth. Now, the next time you breathe in, I want you to focus on sending the breath down into the lower hand. So really feel that belly get bigger and push into your hand. And I don't want that top hand to move so much. So the last thing I want to see is this kind of movement, because that's sending breath into your neck or your trapezius muscles, and that's going to create more dysfunction down the track. So really focus on breathing into the lower belly. And as you exhale, imagine that belly button going towards your spine. Next up, I want you to focus on doing what I term the Darth Vader exhale, okay? So if you're in an office at the moment, maybe move to a private room, because otherwise you're going to get some funny looks from your coworkers. But take a deep breath in through your nose, and as you exhale, I want you to pretend like you're Darth Vader. Now, when you do that, you should be able to feel a vibration or a contraction in not only your core, but your pelvic floor. As I said, your pelvic floor and your diaphragm are besties, and as you exhale, your diaphragm comes up, so your pelvic floor by default is going to contract upwards.
Wow. So this reminds me of the breathing training we have at the Opera House, and how we look ugly, and we've been told you need to look ugly when the stomach is jumping up and down, and that's the best way to exercise the diaphragm. So it is important. And I remind my patient that contraction isn't everything. It's the release that is equally vital. So holding too much tension can actually restrict blood flow and sensitivity. So we want to overcome the over-tight muscles too. So what are your thoughts on how to relax those muscles? Yeah,
so similarly, it's important to be able to relax, because if we go back to thinking what the pelvic floor's job is, one of its jobs is to wrap around the vaginal canal. And guess what is not going to be comfortable if you've got a really tight pelvic floor or a really tight vagina? Penetration, right? And so we see a lot of women who have hypertonic, which is overly tight pelvic floor, that then suffer from things like painful penetration, constipation, and struggles emptying the bladder. So it then creates this cycle of pelvic pain, which is the opposite of what we need when we want to experience pleasurable sex lives. So if we go back to the diaphragmatic breath, we can use that breath as well to help us relax the pelvic floor. So instead of focusing on the exhale and the Darth Vader sound as we contract our pelvic floor, what we can do is every inhale through our nose, focus on the pelvic floor lengthening and releasing or relaxing. Another kind of really great cue is to imagine your perineum, which kind of is that little muscle that sits between your vagina and your anus, which is also a very important part of your pelvic floor. I want you to imagine your perineum, every inhale, pushing downwards or relaxing downwards into the chair or whatever you're sitting on. That's a really nice way to relax the pelvic floor. One of my other favorite ways to relax the pelvic floor is in child's pose, which is a beautiful yoga move. Or alternatively, if you have some space on your floor, simply lay on the floor and put your legs up against a wall. Make like an L shape. And then again, every inhale, I want you to imagine your perineum kind of hitting against the wall and really letting everything relax and go, let everything go.
Well, and certainly men can benefit from that too.
Absolutely. Men also have pelvic floors, which again, no one really talks about. But for men, it's really important when it comes to erectile dysfunction, or erectile function is a better way to say it. It also plays a really key role in helping men get an erection and keep that erection, but also when it comes to men's or male ejaculation. So again, one of those other topics that no one really talks about, and hardly any men in my life to this day do their Kegels. And it's so important for men to keep a strong and functional pelvic floor, particularly as they head into their later stages of life as well.
Well, bonding while optimizing sexual health, I think that's a win-win.
Yeah, couples Kegels, right? Absolutely.
So how do I know that if my pelvic floor is weak?
Really, really good question. There are a couple of key signs, but I want to preface this by saying there's this wonderful graph that we use, especially for physios and chiros when we're learning about the pelvic floor, and that is, it shows us by the time you experience symptoms of pelvic floor dysfunction, you're already well on the way to muscle weakness. So ideally we're preventing these symptoms from happening by looking after our pelvic floor from the outset. But a couple of key signs is stress urinary incontinence, and I know, I'll explain what that is because you're like, what is this jargon? Stress urinary incontinence is the leakage that you would get if you jump or laugh or skip or hop or dance too hard on the dance floor. That is so common. As I said before, 2 in 3 women experience it, but it is not normal and it's absolutely treated. Other signs of dysfunction could be struggles sexually, so struggles having an orgasm or feeling like you just aren't able to grip as well during penetration, but also things like signs of prolapse, which is when one of the organs that your pelvic floor is holding starts to bulge through the vaginal canal.
Yeah, look, I really want to add to this as well, a loss of core stability, or just feel this disconnection between your spine, your back, and your core. And sometimes it's subtle that you don't have to leak, yeah, but you need to engage them all effectively.
Absolutely. And your core muscles or your transverse abdominal muscles are key to helping support your pelvic floor. So it's one of those things that's like, a good kind of analogy would be like nothing in our body works in silo. Everything always works together, and it's important if we're working on one muscle group that we also look after the muscles that support it. So for example, your core muscles are supporting your pelvic floor muscles, your glutes are also supporting your pelvic floor muscles. So paying attention to the entire community of muscles is going to mean you get long-term results.
Well, look, another question, and this is what I have great interest in, is can understanding your pelvic floor really enhance your orgasm?
You guys are going to love this fact. So, did you know that your orgasm is simply starting with pelvic floor contractions or spasms? So the female orgasm, and a lot of women talk about it as this like feeling of waves of pleasure. It starts with the pelvic floor going through spasms and contractions and releases at 0.8 of a second. Now, those contractions then send little messages to other muscles in the body to go through the same spasms. So it all stems to the pelvic floor. Now, another good thing to think about is if you've got a pelvic floor that's not very strong when you reach orgasm, guess what? That orgasm won't have the ability or the strength to have an endurance. So it might be a really short orgasm. And I don't know about you, but like I want my orgasms to be not only full body orgasms, but I also want them to be as long as possible. So I need to make sure that my pelvic floor muscles have endurance.
Look, I've seen this with my patients too, even just learning to engage in the learning and engage in strengthening and relaxation during intimacy can make this profound difference and nuances in the orgasm to a full body orgasm.
Yeah, absolutely.
So, do you think you can voluntarily contract your pelvic floor and enhance arousal?
Absolutely. So one key and fun little fact is during the plateau stage of the female response, the pelvic floor goes through little flutters, and those flutters, the job of those flutters is to increase sensation down in the vulval region and make things even better for you. So if you can start working on voluntarily doing those flutters, not only are you going to increase your own sensitivity and sensation down there because you'll get more blood flow, but oftentimes your partner will also get a more pleasurable experience as well.
Yeah, exactly, and that's the essence of my book, The Unleashed Mysteries of Female Orgasms. We're taking scientific understanding and turning it into real practical, empowering action.
Yeah, absolutely. That's so important because we see a lot of females that just completely disconnect from this part of their body because, as we said before, there's so much shame, misunderstanding around it. So the first kind of hurdle for women to overcome is to get this education and really understand their own body, and that way they can like have a complete awakening when it comes to their own sexual experiences.
Incredible. Heather, any last advice or any final advice to our listeners today?
If I can leave you with one thing, it is get to know your own body, okay? So try and take this stigma away by having a look at what's happening with your own body and having a feel, and also not being afraid to get a mirror out, because I think women as well, with this shame, we're never really told to have a look at what's going on down there. And one of my biggest tips is for women who are like, how do I know that I'm actually contracting my pelvic floor? It would be to have a feel. You can actually give yourself an internal and you should be able to feel those muscles contract and release around your finger. So let's remove the shame, get to know your own body, and treat your vulva and your pelvic floor like any other body part. When you check your breast for lumps or you check your skin for cancers, know what your own pelvic floor feels like.
Beautifully said. Thank you. And if you want to get deeper into this conversation and the knowledge, please check my book, Unleash the Mysteries of Female Orgasms, for a science-based empowering guide to understanding your body. Heather, thank you for joining me. It's enlightening, it's amazing, and I cannot thank you enough.
It's been my pleasure. Today.
And thank you to everyone listening. Stay tuned for more episodes. The Sex Intelligent podcast series where we explore health, intimacy, and the science of pleasure. Until next time, take care, stay connected to your body. Thank you. Hello and welcome. I am Dr. Mike Shinoda from Sydney, Australia, and I am thrilled to introduce you to my book, Unleash the Mysteries of Female Orgasms. This book is more than just a guide. It's a recipe for unlocking the profound depths of female pleasure and sexual wellness. I have dedicated my career to empowering individuals and couples to rediscover intimacy and confidence. So whether you're looking to enrich your relationship, overcome challenges, or simply understand yourself better, this book is your guide. So what are you waiting for? It's available on my website and major retailers. Let's transform the conversation around intimacy together.